Hello, my name is Kira Duggan, and I'm doing my presentation on multiple myeloma. The audience for this presentation would be for an individual that was just diagnosed with multiple myeloma and their family members. So to start off, let's just get a better understanding of what exactly multiple myeloma is. The definition of multiple myeloma is a disorder in which healthy plasma cells are physically mutated. This creates tumors inside the bone marrow of multiple bones throughout the body. Bone marrow is what is found inside your bones, and it contains stem cells that go on to become healthy blood cells. So it's basically responsible for the production of blood. Plasma cells are a type of immunity cells, and these immunity cells produce antibodies. So when the body detects an invader, B cells inside of the bone marrow will be triggered to transform into plasma cells. And these plasma cells will then produce antibodies which go out and bind to these invaders. So as you can see in the cartoon to the right, the plasma cells have all those antibodies that are being shot out to identify an invader. In this example, a flu virus. Unfortunately, these plasma cells can mutate and become abnormal, as in the case of multiple myeloma. These B cells are triggered to create unhealthy plasma cells, which then go on and attach themselves to bone marrow stroma cells, which enhances their growth and survival at a much higher rate than normal plasma cells. These plasma cells live longer and are much more abundant. So not only are they taking up important space inside of the bone marrow, they are also creating mass amounts of antibodies, cytokines, and cytokines are basically substances that send messages to other cells. So they're important in cell signaling. And then it also produces paraproteins, which are basically fragments of antibodies that are released into the bloodstream. So the combination of too many plasma cells and then an increased production of paraproteins, antibodies, and cytokines can create a wide variety of issues in the body. And we'll go on to discuss this in greater detail. So just to review, the mutated plasma cells create an overproduction of antibodies, paraproteins, and cytokines that can cause a cascade of issues on the body. To begin, we will talk about the effects on the blood. As you could see in the last slide, these abnormal plasma cells take up a lot of space in the bone marrow, preventing production of adequate red blood cells, resulting in anemia. Frequent infections is another symptom. As we described in the last slide, these plasma cells are so important in fighting invaders, so when they are mutated, the body is not as equipped to fight. Therefore, infection is possible. The next side effect is on the bones, and this is a little bit more involved. So due to the close proximity to the bones, the cytokines produced by the abnormal plasma cells have a direct effect on bone health. These cytokines, as I mentioned before, are responsible for cell signaling, and these cytokines, listed below, limit osteoblast activity and increased osteoclast activity. So this means there is more bone being broken down than being produced. This then causes osteoporosis, bone lesions, and fractures. In the image to the right, you can see an example of bone lesions. This is when the bone tissue is being broken down at a faster rate than it is being repaired, so there are spaces along the bone that have dents or holes. The next effect is hypercalcemia, and this is when there's an increase of calcium in the bloodstream. This is caused by the bone deconstruction. Calcium is stored in the bones, and when bones are destroyed, this calcium leaks into the bloodstream. This is very dangerous because hypercalcemia can cause muscle weakness, constipation, anorexia, nausea, increased urination, kidney stones, bizarre behavior, and bradycardia, which is slow heart rate. The next effect is kidney disease. And as I said before, these plasma proteins produce paraproteins, which are basically antibodies that have not been fully developed. They are just fragments of antibodies. And when they are released into the bloodstream, they can enter the kidneys and clog up the renal tubules, creating a cast. And this cast can cause obstruction, inflammation, and this can lead to kidney failure. As you can see to the image to the right, The normal blood is supposed to flow right through the tubules. But when a cast is formed, the blood is not able to flow through, and these toxins are not able to be removed from the bloodstream, which is extremely dangerous. Blood chemical makeup can be affected, and dangerous levels of waste products can accumulate. In order to come up with new treatment plans, we really need to do some research on the pathophysiology of multiple myeloma. So here are 3 current research articles that were posted within the last 5 years that are finding more information about the pathophysiology of multiple myeloma. So the first article is the role of AP1 transcription factors in plasma cell biology and multiple myeloma pathophysiology. So this recent research has shown that activator proteins are associated with multiple myeloma cell growth, survival, and bone disease. And as more studies have been done, it has been discovered that targeting activator proteins are one of the most promising multiple myeloma therapies. This article discusses the recent information about B-cell differentiation and the effect these transcription factors have on this process. They are finding that epigenetics plays a large role in the development of these transcription factors and whether or not they assist the cell develop into a malignant plasma cell. By finding ways to dysregulate these transcription factors, multiple myeloma can become much less drug resistant. The article ends by stating that the exploration of this transcription factor is just the beginning, and new technology such as NMR-based screens, differential scanning fluorometry, and 3D modeling, as well as SlimSec, will be used to understand more about the relationship between multiple myeloma plasma cells and these transcription factors. The next article is Non-Coding RNAs in Multiple Myeloma Bone Disease Pathophysiology. As we talked about in the previous slide, those cytokines in the multiple myeloma bone marrow microenvironment were the cause for the increased osteoclast activity. More evidence has shown that non-coding RNA molecules that are responsible for the tuning of gene expression may have more responsibility than we think. In this article, the researchers look at the major signaling pathways in the bone marrow microenvironment and then report the success rate of regulating these mRNAs. The conclusion states that using mRNAs as a target for drugs could be a possible treatment for severe cases of multiple myeloma. The final article is the role of hypoxia and pathophysiology of multiple myeloma through MIR-210. This study, like the previous one, wanted to take a deeper look at the communication that goes on in the bone marrow microenvironment. This study looked at 2 specific types of cytokines and their communication with cells and osteoblasts. It showed that hypoxia-induced MIR-210 increased the mRNA expression of 3 different proteins in myeloma cells. MIR-210 is a mandatory for the hypoxia increased resistance of multiple myeloma cells to melphalan, which is a treatment of multiple myeloma. By the end of the in vitro study, researchers were able to find another reason bone loss occurs at the sites of multiple myeloma, and it is because of this increased mRNA expression due to hypoxia-induced MIR-210. And I know that was a lot of information and may not have made a lot of sense for a person without a science or medical background, but now you know that this research in this field is happening, and it's important because the more we know, the more we can find effective treatment plans for multiple myeloma. The diagnosis for multiple myeloma includes 3 parts. First is the presence of monoclonal plasma cells in the bone marrow, greater than 10%. So this is going back to that first slide in that image of an unhealthy bone marrow, where there are lots of those plasma cells and not a lot of those red blood cells. The second is the presence of monoclonal antibodies in the serum or urine, and this is done through a blood test or a urine test. And then the third is 1 or more CRAB, and this is an acronym for hypercalcemia, renal failure, anemia, and lytic bone lesions. These are done through blood tests, CT scans, and x-rays. The diagrams and images to the right show more detail what exactly the values that are need to be found, but just to keep it simple, just remember CRAB. So multiple myeloma almost always develops from a disorder called monoclonal gammopathy of undetermined significance. The cause of this disease is unknown. However, there is some research looking into the possible environmental and genetic factors. It is also known as MGUS. So it is considered the precursor of multiple myeloma, and it lacks any physical symptoms. So usually people have no idea that they have it unless they get a blood test and see that there is an increase in serum monoclonal proteins, those M proteins that we talked about. The risk factors for this disorder are older age, the male sex, Black people are at more risk than other races, and a family history of the disorder. So there are quite a few different treatment options, and it usually is dependent on the specific stage of multiple myeloma, and I will include the staging information in the slide below. But basically, you would work with your physician, and they would decide on the best treatment. And if one doesn't work, you possibly could try another. So the first treatment option is target therapy, and this uses drugs to kill cancer cells by blocking abnormalities within the cell. So an example would be this specific drug would affect the proteins inside the cell, causing this cell to die. So it's very specific drug that would affect the inside of the abnormal cells. Another option is immunotherapy, and this is using your own immune system to fight the cells. So usually our cells wouldn't fight these abnormal cells because they're seen as normal. However, if we were able to use a drug that was able to target the cells as foreign, then your immune system would go and attack these cells. So that's another option. Chemotherapy can be used to kill the fast-growing cells. Steroids, specifically corticosteroids, are used to control the inflammation in the body that this disorder causes. Another option is bone marrow transplant, also known as stem cell transplants, and this includes replacing the diseased bone marrow with healthy bone marrow. And this bone marrow can be from a donor or it can be from yourself, which is really cool. And then there's also radiation, which would shrink and kill the plasma cells using high-powered energy beams. And like I said before, you would work with your physician and you would see what fits best with you dependent on your stage. And if that doesn't work, you could try a different or you could try it again. Okay, let's look at an example of a treatment plan for multiple myeloma. So first, you'd be diagnosed using that CRAB analysis and the blood and urine tests that I discussed on the previous slides. Next, the stage of your multiple myeloma would be determined based on the 4 factors you see here on the PowerPoint slide. And then your age, overall health, and kidney function will be tested. This is to predict how well your body would respond to a certain procedure or drug protocol. So for this example, let's say you're in your early 30s, your kidney function labs come back okay, and your overall health is good. And when looking at your bone marrow sample, it is clear that there are some genetically abnormal plasma cells, so you would be considered stage 1 or stage 2. You would be considered a good candidate for an autologous stem cell transplant. I'm sorry, I keep mispronouncing that word. Autologous stem cell transplant. So first, your own stem cells would be removed and stored. These are the healthy stem cells. In this process, you'd be injected with a medication that would cause the stem cells to leave the bone marrow and enter the patient's peripheral bloodstream. During this process, you may feel dizzy, chills, tremors, and muscle cramps. These cells would then be stored until the transplant. Next, you would receive a round of high-dose chemotherapy and possibly radiation to kill some of these abnormal plasma cells. And this is why we wanted to make sure that your overall health was good so that you'd be able to withstand these high-dose chemotherapy drugs. Some of the common side effects of these chemotherapies are nausea, vomiting, diarrhea, mouth sores, skin rashes, hair loss, fever or chills, and infection. But medications are given to prevent or lessen some of the expected side effects, and you will be closely monitored during this period of time. After this, your stem cells that have been stored will be injected back into your body, and you will be closely monitored for 3 weeks for any signs of infection or rejection, and you would remain in the hospital until your white blood cells went back to normal. During this time, you'd be on a neutropenic diet and given antibiotics just because your immune system will be so weak. After the stem cells have been infused, you may be prescribed a white blood cell growth factors to help stimulate the bone marrow to produce normal blood cells. Then, you will be allowed to go home and come back for timely checkups. This is typically not a cure for multiple myeloma, but you will most likely go into a remission, a period of time where the multiple myeloma is gone, but it often does come back. For the time being, you'd be in a period of remission. And if the cancer does come back, you'd meet with your doctor again and go through the options. A good resource for this process would be the International Myeloma Foundation, and this website is super user-friendly, and it gives you step-by-steps for all the different treatment options, and has resources, videos, places to donate. So definitely if you are recently diagnosed and you're just looking for quick information that is understandable but thorough, definitely check out the International Myeloma Foundation. Usually when you think of technology, you think of machinery and equipment, but it really can be just the application of scientific knowledge for practical purposes. So going back to that research that we found, using that research and applying it to find effective treatment plans. So the technology in multiple myeloma has increased significantly in the past decade, and the 5-year survival rate has increased to over 55%. So over half of the people diagnosed with multiple myeloma are living for 5 years after their diagnosis. And I just decided to include 4 different types of technology right here. But as you've seen on the research tab that we did a few slides previous, this is inevitable to expand just by how much the research has been going into specifically the pathophysiology of the disorder so that we can come up with more effective treatment plans. So the first treatment plan that I found was monoclonal antibody drug treatments, where the lab will make antibodies that bind to the surface of the multiple myeloma cells, and so that the chemotherapy can go directly to those antibodies and become more effective killing those plasma cells. The next is the antibody drug conjugates. This is when a specific antibody is found on the myeloma cell and chemotherapy is able to be delivered right to the multiple myeloma cell. So it's highly specific. The next 2 are the most recent, and these are the CAR T cell therapies and the bispecific antibody drug treatments. And this is engineering the body's own immune system to attack the multiple myeloma cells. So in the second one, the bispecific antibody drug treatment, this drug is going to recognize an antigen on its own T cells and then also recognize an antigen on the myeloma cells, and by doing that is able to activate the T cells against the myeloma cells. So as I said on that past research slide, research is increasing, and the more research that we do, the more we're able to understand exactly what is happening to cause these plasma cells to become differentiated and harmful. The more we know, the more we're able to find effective treatments to treat it. And then this slide has a link to a concept map that you can click and just go through, and has a little bit of everything that we talked about just in a clear format to get an overview of everything. And I know this was a lot of information thrown at you today, so if you go home and realize that you need more information, These are some resources that you can use to get whatever you like. There's information about treatment options, payment, symptoms, and all you have to do is Google these names and you will get access to a bunch of information.